My name is Alejandro Gutierrez. I'm the CEO of Giostar Mexico. Thank you for joining us. We have a great topic in front of us, very important, very interesting and up-to-date topic, controversial as well. We're talking about COVID-19. We have three different guests. I want to introduce all of them. First and foremost, I want to introduce Dr. Anand Srivastava, a great scientific leader, a great scientist as well. He practically started the stem cell field in America, the research field in America. We're going to talk about that in a moment. He is the founder of the Global Institute for Stem Cell Therapy and Research. Thank you for joining us, Dr. Anand. Thank you very much, Alejandro. And I would certainly like to welcome today our most precious guest, Jana Breslin and Evan DeMarco. And why I told they are the most precious today, because in this COVID-19 situation, and it is grave situation today, in fact, and I feel very sad coming on the webinar for this particular topic. But I was talking about Jana and Evan. They dedicated their life for the making the people healthy and just tweaking their lifestyle a little bit, and how to manage your good health through working, whatever you are working in the mainstream, and just diverting a little bit exercise and nutrition. And they developed such a wonderful instrument on the web page, the media, the social media, the telephone or phone apps. So I really thank you, Jana and Evan, for today. And people really need your help today.
Thank you so much for having us.
Yes, thank you for having us.
Perfect. So, yeah, thank you for the introduction, Dr. Anand. Thank you, Jana. Thank you, Evan, for joining us today. Like I said, we have a very important topic ahead of us. I just want to take a moment, and Dr. Anand, I want you to take a moment to explain a little bit about yourself, your background, and the company's Giostar, and so people can understand why is all the information here so backed up by science. So why are you an expert, and how are you an expert in this matter? And people understand that we're not talking about something that we just we just came across. We have a strong background on this. So I want you to talk about yourself and the company for just a few minutes, please.
Thank you, Alejandro. Again, it is very difficult most of the time to talk about yourself, but it is sometimes important, because Giostar as such, we founded long back in 2008, but it contains so many scientific minds, and the people. I myself started my life at University of California, San Diego Medical School, when I started working as a postgraduate researcher, that is after the PhD basically, and then get scientific positions there. And I was continuously thinking how I may help people with so many devastating diseases. So, and that particular time, certainly it was not COVID-19, but a lot of genetic and metabolic diseases like thalassemia, sickle cell anemia, ALS, MS, lupus, name it, diabetes, hypercholesterol, thyroid. And I was working on gene therapy, in fact, but it was very, very complex, and it is very complex. And I was continuously thinking how I may bring easier way to manage this kind of problems. And then the stem cell idea came in my mind. So I started working on stem cell in 2001 at UCSD, San Diego. And I was fortunate enough to show first time that, yes, we may manage damaged brain and immune related problems and all these things. So I do not want to go in much detail about my personal background. I have published a lot of scientific manuscript related to stem cell science, which is available at National Institute of Health Library, that is also called as PubMed. Anybody may go, and if have some interest may get, or they can also ask me directly. I may send my publication to them. But so then, because I always been in the academic institution, so I have a lot of good people around me, my mentors, my friends, and my younger scientists. And our mission was always to manage and help the people who are suffering from incurable, devastating metabolic diseases, which really do not have any cure at this particular time. So that's what the stem cell story, and that's what the Giostar, which is not only me, in fact, they have Giostar has a lot of scientific mind and clinical doctors like MDs and PhDs. So we are continuously working, and unfortunately, this particular time, we are suffering with this devastating problem that is COVID, and I'm shocked, and I never imagined that our country here in US, we have such an advanced medical system. Lost 50,000 lives. Today, I was just watching the CNN, and I cannot say, Orlando, how painful it is for me. And continuously, I'm thinking how and why we are losing this many people, why we are unable to do something for them. So that is the main point here. And today to talk, discuss, and certainly I invite everybody's viewpoint also, and idea or help, whatever way they can help to stop this particular problem, which our country is suffering and not our country. And I was talking with Evan, and Evan told me that globally around 200,000 people died, if I. So this is something very devastating. So then I started thinking, is it possible somehow to manage this COVID infection using a stem cell? And I'm talking in January, okay? When I was listening this problem and having this problem in China. And I was just thinking, is it possible, not possible? And because nobody has done ever, and I certainly never worked, particularly stem cell and virus. I have worked on the virology, and I published a paper in 2004, how the immune system washes away the virus, and that was published in Journal of Virological Methods long back. So in the meantime, I was thinking, and a very wonderful publication, very excellent publication came from China, in fact, but it is not exactly from China, though the patients were treated in China using a specific kind of stem cell, that is mesenchymal stem cell. And that paper came out of collaboration of several countries, not only China, but it was China, it was Israel, it was Spain, Russia, India, Korea, UK, and USA. So this many countries, in fact, collaborated together for this particular study, which was done in China. So what happened there, that of course, China suffered first with the COVID-19. And so they used a specific stem cells that is called mesenchymal stem cell. And we know very well, and the people who are working in the field of stem cell science, they know very well. And almost, I think 20,000 people might have used, more than 20,000, this particular stem cell, that is mesenchymal stem cell, for different kind of problems, to manage different kind of problems. And there are a lot of publications related to mesenchymal stem cell, managing the immune problem and balancing the immune system. So this was the stem cell they used in China, and they used on very critical patients who were not having any other option, but almost going to die because of this COVID infection. So what they did, Orlando, they infused this particular mesenchymal stem cell, intravenous injection, just in the blood. And this particular mesenchymal stem cell is well known to manage the immune system. And this particular stem cell has wonderful, wonderful character. You do not need to match this stem cell. So it is immune competent. So when I'm telling you do not need to match, it means I can give my stem cell to X person without any problem. And this has been shown in several publications, scientific publications, which is available on the PubMed, as I told. So when they injected, so they found the effect of this virus. So let me first explain, that is very important, what is the COVID and why it is really killing so many people. That is very important to understand. And so what happens, this particular virus, that is COVID, that is the RNA virus. So I'm not going to detail about the genome and all this character and structure of the virus. But when it goes in the body, most of our cells has a specific kind of receptor, that receptor known as ACE2 receptor. And these receptors are very much available on the epithelial cell and endothelial cells. So lung epithelial cells and alveoli and alveolar cells has this particular receptor. And you see, this is fantastic work of nature, I can say you, that all immune cells like T cell, B cell, lymphocytes, and particularly this mesenchymal stem cell also does not have this receptor. So virus cannot infect these cells, but because epithelial and endothelial cells has this receptor, and this COVID virus has a specific spike, that is S protein spike, this particular goes and bind to this particular receptor like this in the cell, okay, and injects it genome inside the cell and take over the cell. And once it take over the cell, it start multiplying and kill that cell and come out hundreds of other viruses and infect other cells. So during this process, and thank you for this slide, Orlando, because this is very important slide. So, so this particular virus, because of this thing, it triggers a strong inflammatory reactions, and lot of cascade of cytokines, inflammatory cytokine get released. That is IL-7, 6, 2, there are a lot of, and the inflammatory gene TNF alpha get upregulated. So lot of cytokines cascade. And because of that, lung has edema. And because it ruptures the cell during the life cycle, so lung has scar also, the damage. So that's what people feel, a lot of pain, suffering. And because of lung is full with edema, that is water, so oxygen transport is very, very less. So person cannot breathe and have a lot of pain, fever, cold, all the symptoms which you are listening nowadays on the television 24 hours almost. So that is the point. So now we know that this virus releases, because of this virus, a cascade of pro-inflammatory cytokines released. So it is obvious to think as a scientist for me, what is the way we can manage this? So yes, you can do immunotherapy for a particular cytokine like IL-6, 7, or you inject. So because this virus triggers cascade, so you cannot use a single cytokine or antibody for this, like IL-6, like IL-7, because then you have to inject a cascade of anti-inflammatory cytokines. So that is not possible. Okay. Another way to manage is of course, the vaccine, which people are day and night working. So somehow, if scientifically, if we manage to suppress this particular cytokines, which are pro-inflammatory, or neutralize these cytokines using something, so we may help or reduce the effect of this virus on the people body. So that's what this publication came. So when this particular mesenchymal stem cell, which is available basically on the fat tissues, the bone marrow of a person, and also very much available in the umbilical cord. That is cord cells. So and it is well known that it downregulates the inflammatory gene actions. It releases several cytokines which neutralizes the pro-inflammatory cytokines. It means it releases anti-inflammatory cytokines, okay, and like IL-10 and all these things. So, and also, so these cytokines are neutralized now because the pro-inflammatory cytokines, which is triggered by this virus. So this mesenchymal stem cell goes and stops this, and then these mesenchymal stem cell has a wonderful abilities to release a specific cytokines which may go and try to regenerate the damage or repair the damaged portion of the lung. So it works in two ways. Certainly it is not going to kill the virus, okay? So I want to be very clear here that it is not going to kill the virus, but virus automatically completes its cycle and goes away anyway. So we have to manage that particular window which people are suffering, okay? And if we can somehow stop this suffering period, then people are going to be rescued anyway. So that's what this paper explains, and that's what I personally suggest. And you will be surprised to know that last week I see the FDA approved 2 clinical trials using the mesenchymal stem cell to manage the people who are terminally ill or sick with the COVID-19 infection. So in US it is going on, and yesterday one of my friend company and told that they use compassionate use for one person only because it was personal one patient. So compassionate use, FDA allowed to use mesenchymal stem cell to help that person, and that person was rescued, saved because of the infusion of the mesenchymal stem cell. So I would like to show you, Alejandro, that wonderful slide which showed how, yes, this slide. So if you see the COVID-19 infected lung, you can see white spot is too much white spot. So here the cell was transplanted, okay? And this person has a lot of problems in the lung. And now you see, after the 1 week almost, this infection is almost gone and this person was rescued. So this is the best possible way at this particular time when we are developing vaccine, all other things. And several companies in US as well as in Mexico. Mexico government allows to use the mesenchymal stem cell for different kind of diseases, which we have used several patients and several people this adult mesenchymal stem cell under the guideline of Mexican regulations. So we have our center in Mexico, Las Algodonas and Cancun. There we can do, and I also applied the FDA here in USA, a pre-IND, and I am under the process of my application, and hopefully FDA is very open now. And the truth that we never thought that we will lose 50,000. And Alejandro, if you remember, I was telling you, I don't think we will lose more than 20,000. But now I am really devastated and shocked. I do not have words, you know, I never imagined. You remember that a lot of news channels and everything is telling, Ivan, if you remember, that young people is not having this problem. Mostly old people are suffering, and the people who are having underlying conditions are suffering, okay? So that itself is very clear why it is like that. The question, okay? The question is, when the young people has a lot of stem cells, that is mesenchymal stem cell. So if they are getting the infection, this stem cell which is already inside their body is countering them, okay? So these young people are not having that much effect. the people who are older also, but if they are not having any kind of underlying situation or disease, they also have available stem cell. Certainly not very higher number, enough to counter this virus. But the people who are having underlying situation or some disease condition, this stem cell is already trying to that particular disease since long. So when this virus is attacking, so the available stem cell is too less, and immune system is also compromised. So that's the reason that so many compromised or underlying people who are having different diseases, and old people are dying more in comparison to the young people. So that's what it is. And I really think that hopefully we must follow all the instructions, like social at this particular time, social distancing, and don't take the cold water at this time point. I will say the ice cold water. Try to drink all the warm water with some time of herbal tea or curcumin, that is turmeric. And that is your part, Ivan and Jena, anyway, to tell people, because I'm not the expert, but certainly I think that vitamin C is also very important with the vitamin D and multivitamin at this particular time. Some breathing exercises, very important. So that's what I wanted to talk about COVID today, and what we may offer as a Giostar to help the people, to save the people. And certainly, as I'm telling, that this is not the ultimate, this is not the last, this is just a way or to manage this disease, not killing the virus. So that's all, and thank you very much. If you have any question or anything, please, Evan, Jena, and Alejandro.
I thank you, Doctor, and thank you for the explanation. I think I already have some questions from the audience actually that we can solve. However, I want as well for Jena and Evan to share their questions. I know that they had some questions before. I just want a small introduction into the stem cell world, because when I saw the reaction that we were getting from people on this particular topic, I saw a lot of confusion, about the way those cells were acquired, the way that those cells were gathered and harvested. And I see a confusion between adult stem cells and embryonic cells. So I think that's an important topic to discuss, because a lot of people may have closed or put a barrier between stem cell therapy and themselves because of lack of that particular knowledge.
Okay, very good, Landro. So let me tell you, and this is very big confusion since I started in 2000, and from that particular time, I myself is trying to explain and struggling, but I have to choose which is the good for the people and good for the science. But anyway, so coming on the embryonic stem cell and adult stem cell. So we are using adult stem cell to treat few kind of blood diseases in US and around the world last almost 40 years. And that is approved by FDA. And what are those adult stem cells? Those are the technically called hematopoietic stem cell or blood stem cell. So we know when a person is suffering from blood-related disease like leukemia, lymphoma, thalassemia, or sickle cell anemia, these kind of disease. So doctors recommend for the bone marrow transplant. And what is that bone marrow transplant? Bone marrow transplant is nothing but hematopoietic stem cell transplant or blood stem cell transplant. So that is a kind of adult stem cell. Embryonic stem cell comes from the developing embryo, which nobody using to treat the human being at this or injecting in the human. And we do not support that as well, because it's not needed at this particular time, because science is much advanced at this particular time. if I'm talking about mesenchymal stem cell, so that is a kind of adult stem cell. And as I told, it comes from the bone marrow. It comes from the fat tissues, belly fat or any fat tissue. It also available in the umbilical cord when the baby born. That cord, which generally discarded by the clinics or hospitals, that particular umbilical cord has a lot of mesenchymal stem cell. And our blood also has mesenchymal stem cell. So this is an adult stem cell. There is no connection between this stem cell and embryonic stem cell. So we do not need to get confused or worried about that ethical issue related to embryonic stem cell.
Well, and Dr. Anand, I'm glad you brought that up because I think that, when we first really started talking about stem cell therapy on the Life to the Max podcast, and recognizing that there is a conversation to be had about how stem cell therapy can be a novel treatment for regenerative health, as well as really looking at a lot of the indications that you've spoken about, whether that's, blood diseases, sickle cell anemia, things like that, where some research is taking place. We wanted to make sure that our audience was completely aware of where the ethical issues, came on in reference to where these stem cells are harvested. And I know that for a long time in the United States, there was this whole conversation that stem cells were derived from dead babies. And that's clearly not the case. And so I think just to reiterate what you're saying is that we're very excited to participate in a conversation where we get to move the education forward on where these stem cells come from fat, from bone marrow, from healthy donors, versus, this kind of archaic conversation that, these are basically you're injecting dead babies into your body. And so again, I think we're back to that same conversation. Is thank you for clearing that up, especially for our audience who to a certain extent has been a little concerned about that topic. And we are very, very excited to move the conversation forward that these are healthy stem cells, not derived from that, but from fat and bone marrow. And then, the research into these type of stem cells, the mesenchymal stem cells, allows us to talk about all the different indications, whether that's COVID, whether that's, leukemia, anything like that. So now one other question I think I have, and to that extent is, I want to go back to some of the research that you were referring to in China. Is how many people were treated with stem cells in China, and do you know the outcome of that, of that treatment?
This particular time, I think almost 20 or more than 20 people, and they almost all were rescued, and they all were critically ill people. That is the biggest point. So that's what
when we say critically ill, so when we say critically ill, I want to bring this up because I think this is an alarming statistic that was relayed in the news from Johns Hopkins University, as well as I think the CDC, is that over 80% of all patients who end up on an intubator end up dying. And so when we say critically ill, were these patients on an intubator? And to your knowledge?
Yeah.
Okay, so that's exciting unto itself. Is that critically ill on an intubator, by virtue of this, the data suggests that there's a high probability of mortality. And so being able to pull people back from that precipice using these stem cells is a pretty impressive, I know it's in a vacuum, and I know it's, it's not a double-blind placebo-controlled clinical trial sponsored by the FDA, but in that sense, being able to make those type of, leaps in the science, I think goes a long way to really talking about how this is a therapy that can be used to treat, especially critically ill patients in COVID who, based off of the statistics, don't have a high likelihood of recovery.
Mm-hmm.
You're right. Even this particular situation is very, very different than a classical disease outbreak or something, because this is something like a war situation. And now I started even thinking, and I think everyone must be very agree that we have to develop 3-layer of defense system for our country, that one is military, of course, but now it seems to me that more important than military is the medical system and the health system, and the military comes next right now. And then third is the telecommunication or communication or internet. cyber security, you can say. Without that, I think we cannot survive anymore. You see, means this particular virus is attacking basically on our defense system. And who are in our defense system? Behind the military is the doctors, the medical people who help when there is something happening or devastating thing is going on to our soldiers or our people. And now it is attacking to people, and you see the doctor who are going to treat, they know they may get infection, they may die, but still they are going. So you can feel that such a dangerous situation and dedication of the medical field, medical personals to help the people. I really feel so grateful to them and their courage. And we must think to make our medical system and the scientists, doctors, same as military at this time point, and fund them up to that level. And I please request everybody, please make your voice to make this medical personals and these people who are supplying and all these things to get and bring them up at the front like any other job or services.
Okay,
Great.
I want to, sorry to interrupt. I want to ask the audience if they have any questions, if they can share it in the Q&A section as well. We're gonna try and go through them in a minute. Someone sharing an important question, and I want to share that question with the audience and even share it myself because being responsible for the operation here in Mexico. Someone's asking, seems that this treatment will be for people who are in advanced stage of COVID sickness. In such cases, how are they going to be able to travel to Mexico? I think it's an important question, and I think it's actually something that we discussed at another time with Dr. Anand as well. Stem cell therapy as a treatment, it's one thing, but it's also very effective as something to be done before, preventively. Dr. Anand even mentioned that, and this is common knowledge, at least as common as it can get with this new infection, that people who are in the worst situation are those who were suffering from underlying diseases that compromise their immune system. So we have actually received a few patients here in Mexico who are concerned about their immune system being down, and they are treating those underlying diseases, not necessarily the infection of COVID itself. I think it's an important question as well. If someone is very ill, can they travel to Mexico? I think it has to do with their own personal situation, that we have different locations, and I want to talk about that in a moment as well. But one of our locations, which is Algodones, is very close to the border. So the border is open for medical traveling, and we have been receiving patients that are able to travel, that are still able to travel and can cross the border to be treated here in Mexico. Dr. Anand, I don't know if you want to add something to it.
Yes, you are right, Alejandro. And I was discussing this particular paper, that in this particular paper, because they cannot just go and use the stem cell to anybody. So they used because, and government allowed in China to use because they were not having any other option. But when they used, they got success. So that particular study also suggests and tells us that when this particular stem cell can be or may be used for such serious patients, not to use as a prophylactic or preventive way to give the stem cell to the people who may have chance to get exposed or maybe having some underlying condition. So their immune systems are ready if at all they receive or get infected with the virus. So they may counter the virus in advance. So it is not necessary that when person is terminally ill or very sick, only then they can take the stem cell. They may take in advance just to manage the situation. But all these things really need a lot of study and other things. But because this is grave situation, this is war kind of situation. We are not talking in a classical situation this time point. Whatever way we may manage, whatever way we can help, whatever way we can prevent people dying, backed by the science, we must try. This is emergency situation. We have to understand that as well.
Okay, so Evan, Jana, do you have any other questions? I think that we still have some time. I think it's, you may have some more questions for Dr. Anand as well.
You know, I think one of the things that we talk about when we look at some of the therapies that have been, can you guys hear us?
Yeah.
Okay, sorry, my Zoom said my internet connection was unstable. As you said, Dr. Anand, it's, you know, once the web goes down, we're all going to be a caveman. But you know, as some of the therapies that we're really hearing coming out of you know, the medical community right now, and I want to say medical community versus the political community, because I think we all read in the news today that, you know, injecting yourself with disinfectant based off of what a certain political figure in the United States said is not a good idea. And I think the CEO of Lysol got on the internet today and said, please don't do that. But I think we've talked a lot about steroids. You know, when do steroids come into the equation? One of the initial concerns was using steroids to, you know, to downregulate the immune system. You know, knowing that the cytokine storm was really kind of the thing that was, you know, cascading people over the edge. So as we kind of talk about, you know, stem cells downregulating the immune system, how does that work in dealing with the inflammatory response, specifically as it pertains to COVID-19, or I think any other, you know, viral attack, especially in the lungs?
Yeah, so that is one thing, to use some kind of steroids also, and people use that, and the steroids are well known for anti-inflammatory actions, and that triggers a lot of anti-inflammatory cytokines once you inject or take the steroids. But again, that is not very effective at this particular time, and that can be given only when the person is not having any other option. So few people got rescued with this steroid as well, and you're right, Ivan.
You know, it's funny. I think we had a chance to talk about this prior to the webinar, and it's funny when you guys invited us on this. I think we were really excited to discuss stem cells as a novel therapy, and it's funny. I kind of want to address something that seems to be the case with us, as we've kind of shared this with our social media, is people thought when we said therapy that we meant cure, and I think to date there's clearly no known cure for the COVID-19 virus, and when we talk about therapies, whether that's taking vitamin C, getting a little bit more exercise, deep breathing, vitamin D, some things that we know are immunomodulating and immuno-optimization techniques. We're really discussing stem cell therapy as just an extension of a healthy lifestyle to really bolster or optimize an immune response to something like this. And so I guess, first of all, I want to say thank you for all the information. I feel like we needed an interpreter, with you, because, taking your science out of your brain and making it digestible from the layperson is impressive. Clearly you are one of the smartest people we've ever had the opportunity of working with. And so to that extent, I'm also excited to really kind of talk about what does the future of stem cells hold in the United States? Is this a path forward? Does COVID-19 represent a path forward where the FDA is going to have to start looking at stem cell therapy as more of a, I don't want to say preventative, I don't want to say cure, but as a therapy for not just COVID-19, but other things? Does this really open up the door for us to have a much broader conversation about the use of stem cells in a number of different occasions?
I think you are, Ivan, you are breaking, but if I understand your question, that what is the situation of stem cell, and what is the current progress related to other diseases? If your question is this.
Not just that, Dr. Anand, not as it pertains to other diseases, but really the regulatory path forward in the United States. Do we feel that this presents an opportunity for us to really outline a clearer direction for the use of stem cells in the United States?
So it's a good question, Evan. And so like all other pharmaceutical agent or any other things, as I told, that stem cell is already under practice, approved by FDA. That is adult stem cell, and that is hematopoietic stem cell, that is blood stem cell, under use last 40 years to treat blood-related diseases. And why? Because yes, you have to go for double placebo trial and all these things, and target a particular disease, and you show that yes, it is going to help, and you get approval, and you start treating the people. The same way, as I told, now FDA approved clinical trial for COVID-19 as well, using the stem cell, that is particular mesenchymal stem cell and different kind of stem cell. So FDA is very open for any disease if you go through proper manner. Like we are under the process of diabetes type 2 with the FDA. Our application is under process, and for COVID-19 also, our application is under process with FDA for US. And but we are having even better fortune that government of Mexico allows to use the allogeneic mesenchymal stem cell to manage different kind of diseases. So we work under the regulation of Mexico at this particular time point. And as soon as we get approval and other things with this FDA for our country here at USA, we may be doing that as well. So saying that, yes, FDA is open, and we have to follow the guideline and regulations, and they will approve, and they are ready to approve. They are very cooperative.
And that's great. And the last thing that I would ever want to do is kind of turn this into a political discussion. But I think one thing that we've learned from the medical complex is that the standard of care implementation timeframe is about 17 years from the time that something actually gets approved, through trials, which can be anywhere from 5 years on. That stem cell has the potential to switch an FDA button. But when we really look at that, 17 years, is that the value of going to places, maybe that's like India or Mexico, or countries that recognize the inherent potential of these therapies? And I don't want to say fast track, because I think that's a misnomer, but have put in place mechanisms that allow people to get therapies outside of the United States, knowing that it could take 17 to 20 years before it becomes available to treat a certain disease where someone might not have 17 to 20 years to wait.
Yeah, Evan, this is of course, it is a little unfortunate situation. And this is the job of the scientific community and medical community to come up and convince the FDA and the people who are in the regulatory agencies, because we have to understand one thing, Ivan, that they are also the people back, and they are very good and very smart people. They are also there to help in development of new medicine for devastating diseases. But at the same time, they are not the expert of every single science. So in fact, I think Alejandro, we lost Ivan and Jenna.
I think we lost their video, but they're still in.
So I don't know if we lost them because of the internet, because I was having problem listening them.
Yeah, but I think that we lost their video.
Okay, but they can hear us.
Yeah.
Okay, so I was just telling they're good, but this is the job of the scientific and medical community. Okay, now you guys are back. So to make them understand that this is the important, because if we go, I'm just talking very general, like all kind of diseases. If you think what kind of, and you see what is happening with the COVID-19, if something is coming like this new, so we must be ready to fight and come in action immediately, whatever tools or weapons we have in our hand to fight, and have ability to decide whether it is correct or not. And that's what the role of the scientist and clinician comes, like me and all other people who are working in the field of science, to come in front of our regulatory agencies, because they are formed to help the people. They do not have their own personal agenda, but we have to tell them. And that's what I am trying to do that. And I request every single scientist or clinician or the people who can tell the correct thing. So this is the process, and hopefully regulatory agencies at this particular time, certainly they are understanding very well, because nobody imagined that 50,000 people we will lose like in 1 month. Nobody. And we cannot say, Evan, that we do not have this data, that data. Means I have every single day I'm asking a question myself that suppose if some attack was there from outside, a military attack on our country, like Pearl Harbor, would anybody accept that we do not have data before? We do not have that weapon, that rocket was coming from that side, so we do not have data how to counter that rocket if it's coming from south, not from north. No, nobody will accept. Everybody will say, whatever you had or have, counter that. But here we are talking on television every day. We do not have this data. We do not have that data. Miss, people are there from 20, 30 years as a chief of a particular division. I do not want to take the name of anybody, but important is that that's what the responsibility. When there is an emergency situation, you have to show your ability to react and help, not waiting that when the 50,000 people will die, then I will get data and then I will decide how to help. Anybody can do that. Any scientist, any general clinician can do. The leader means if there is a problem and you have to come up front, you have to save the people, and that's the knowledge comes. But I do not want to go in that direction this time. It is devastating.
I think that's
suffering. I'm having a lot of pain right now. I can tell you. And I do not have all the tools in mind.
Sorry to interrupt. I think I just want to add something very important before getting into other questions. That we're actually having a lot of questions from the audience as well. You mentioned, Evan, and that Giostar has trying to, you didn't use, well, you use fast track, but at the lack of a better word, and I understand why, to go to Mexico, India, or other places where they can actually apply these therapies. I think it was a stroke of genius from Giostar to try and look for other options. Most of the serious companies who are doing research in America are doing exactly the same. And we were looking for places where we could work. And a lot of people think Mexico is a place where you can work because of the lack of regulation. And it's actually not. and I think it's an important topic. Mexico's their version of the FDA, which is the COFEPRIS, the COFEPRIS has a license for stem cell therapy clinics, which is not something usual in many places in the world. They have a special licenses and regulations for banking, laboratory, and application centers, which we do have in our centers as well. I think that's a very important topic, so people know that they're going to a place, if they decide to go to Mexico or India or a place where we are working, they're going to a place where we decided to go because they are the means and the way of working within regulation. That's very important.
And I'm glad you brought that up, right? Because I think that's one of the concerns that a lot of people have is, yeah, go to Mexico. Medical tourism is this thing where you can get, you can get cheaper procedures, you can get cheaper, cheaper care, and that's not necessarily the case. But also, as you pointed out, is that the regulations there. It's not like you can just, open up a building and say, hey, we're doing stem cells. There is a practice and a protocol in place that allows you guys to have a license. And I remember talking to you about that, Alejandro, and being very impressed with that. And I think one of the things, we talk about medical tourism is, you guys are doing the research down there. You guys are focused on, treating specific things. You have the history, you have the pedigree. And so I think, quite frankly, it's one of those things where we really wanted to open up a conversation and allow our viewers the opportunity to take the facts. The facts are, that we're not using dead babies, that there's, that these are fat-derived stem cells, bone marrow-derived stem cells, that there's some research being done on specific things, that there's not a lot of research being done on stem cells for curing COVID, but that there's some research and some, extrapolative math that allows us to say, hey, maybe this is a great opportunity for us to support our immune response, to, to do a lot of different things to improve our health. And maybe as the medical complex tries to understand how to deal with this virus in the future, to get out in front of it, just, before it mutates, before we start to see spikes again, that these are great things that we should, that our viewers can consider. So to that extent, I just want to say thank you for letting our viewers that are watching this know that is that we're not sitting here saying, get on a plane and go to Mexico and get stem cells, but take a look at the facts and recognize that Giostar Mexico has done a lot of legwork to ensure that, this is a regulatorily compliant facilities in Mexico, and that there's a great opportunity to look at stem cells as a impressive way to support, immune optimization.
You are right, Ivan. And Anand, I have few questions on Zoom chat.
Yeah.
Just quickly, some Smith asking that why not we can use hematopoietic stem cell, that is at the place of mesenchymal stem cell, because hematopoietic stem cell does not have that strong immunomodulatory function, and also we have to match every time if we are going to use allogenic hematopoietic stem cell. So it's a very long process, and certainly it is not strong, having a strong immunomodulatory function as mesenchymal stem cell has. So that's the reason. And the second question is a very interesting question actually, that can we reprogram the stem cell according to viral genome to counter the virus? Okay, so very good thinking, but if we are going to reprogram stem cells, so even so every time when we do something, we always try to make it easier. Okay, so reprogramming of any genome is difficult, but before, and if you want to reprogram that, then vaccine is even easier, because you are going to counter the viral genome. So just reprogram and make a vaccine for the virus genome or virus. It is easy in comparison to reprogramming stem cell and countering the virus. But yes, it may be. It might possible. So,
Dr. Anand, you'll see a lot of questions in the Q&A section on the top.
yeah.
I mean, I don't think we have enough time for everything, but
Okay.
You can choose some of the questions there that you think are going to help. I see one that it's interesting because I know it's something a lot of people, even seeing this webinar afterwards, may have a difficult time solving on themselves. Can you describe why injecting stem cells improves your ability to fight COVID? I already have stem cells and fat and bone marrow, so how does injecting more help? I think that's a very common question. You know, if they're taking out of my own body or someone else's, but I already have them, why having more?
And that's very good question. And I explained, Alejandro, that why the young people are not dying in comparison to old or the people who are having underlying situation. Because the young people has lot of available stem cell in their body. And if they are going to get any infection, including COVID-19 first time, then these stem cells which are available in their body counters and they suffer a little bit, but they are not going to die. So they really don't need mesenchymal stem cell. But the person who are old or having the chances of some kind of underlying disease or having some kind of disease or compromised immune system, old or young, a lot of like arthritis are there, diabetes are there, lupus, vasculitis, multiple sclerosis, ALS, you know. So that particular time, those people may need, because once the virus attack to them, very quickly their body get compromised and they start having very strong symptoms. So these people has to take more care, and that's what they need, this particular stem cell. So they may get help at the right time before they go up to that stage where the point of no return, I can say. So that is very important to understand, that everybody does not need. Any person who's following a healthy lifestyle, breathing, exercise, certainly they don't need to worry too much.
Thank you, doctor. We have another question that it's very, very on topic, that it says, can mesenchymal cells help to overcome pneumonia?
Yeah, that's what. So if you will say pneumonia, then pneumonia is a very general term. It can be pneumonia can come because of some bacterial infection. Okay, so if there is a bacterial infection, certainly you need antibiotic to kill the bacteria for the pneumonia. So, but in this particular viral pneumonia, which is caused by COVID or any other virus maybe, which triggers the cascade of immune reaction and pro-inflammatory cytokines. In that case, this mesenchymal stem cell may help because it neutralizes that pro-inflammatory cytokines with anti-inflammatory cytokines and release the cytokines which may regenerate the damaged portion of the lung in case of pneumonia. But not the bacterial, okay? For bacterial pneumonia, you have to take the antibiotics, and those are well available.
Thank you, doctor. You're going to be able to see more questions here in the Q&A. Again, we don't have time for everything, but maybe you can select one of the questions that you think it's important.
Yeah. So as I told that I already replied for, and depending on the application. I already explained most of the things.
Okay.
So one person is asking that in US whether we have applied for FDA. Yes, we have applied to FDA for COVID-19, and our application is under process. And we have ability to do in Mexico already, because Mexico government and regulatory agencies allows us to do that.
And
so that's what we are talking about Mexico this time.
You did mention that you already applied for the FDA approval on COVID and diabetes type 2, if I recall correctly, right?
Yeah.
Perfect. There's an interesting question, just maybe to wrap it out before any more questions that Eva or Elena may have.
Yeah, Alejandro, can I just stop? A very interesting question is that mesenchymal stem cell transplantation requires anesthesia. So no, it does not require general anesthesia. It is just same way as like infusing any kind of cell in or any solution in your IV, in your blood. So you do not need any anesthesia for this.
Mm-hmm.
And it takes maximum 20 minutes. Stem cells. Yes, please, Alejandro, you have something.
There's a question that says, since the stem cell therapy is downgrading the immune system inflammatory response, does that slow down the immune system's ability to clear the virus overall?
No, because okay, there are two parts here. Virus is having its own life cycle, and that will be completed within a certain time point. Okay, and at the same time, antibody is getting generated in your system for that particular virus. What stem cell is doing here, just suppressing those pro-inflammatory cytokines. Because of that, a lot of secretion is in the lung that is forming the edema, the water filled in the lung. So the oxygen transport of the lung is drastically reduced. That is called oxygen stress syndrome. Okay, and then because of and same time the lung cells are ruptured because of this virus infection. So the body is fighting at several fronts. This stem cell goes and stop that pro-inflammatory cytokines. So there is no trigger of the immune reaction on all these things. So you don't form any edema and other thing. So though the virus is present in your body, you do not feel the effect of the virus. And this, the cells which are damaged because of this virus, these stem cell secretes the molecule which enhance the repair of that and help in repair of that damaged lung cells or tissues. So this is the two way. And by the time virus completes its cycles and you generate the antibody in your blood, so you are secured. So this is a kind of management, beautiful management. And it is given by nature to us. Why we are forced to give stem cell from outside? Because in few people, because of some situation, they do not have enough stem cell in their body. If they have enough stem cell, they may not have that big effect of this virus. You're so asymptomatic coming in the story, and people are having virus, not having a lot of symptoms. Young people are having less symptoms. Old people are having more symptoms. Underlying situation, people are having more problems. So all these things. The stem cell is the point here. And healthy lifestyle. Healthy lifestyle is also very important.
We have a question about someone, very specific question. Can stem cells work for kidneys CKD problem?
Okay, so the report tells, and a lot of publication on the CKD and mesenchymal stem cell available, and it indicates and suggests that it may help in the kidney problem, but again, it depends what is the situation, how much damage in the kidney, and whether it is totally damaged or something, because stem cell can repair the damaged portion of anything, but it cannot, or it may not go and make entire new organ. So saying that, yes, it may depend on the situation, because the publication tells and indicates, suggests that way.
And the reason why I think that question is important, thank you, Dr. Anand, for that answer. But the reason why I think that question is important is because, as we shared before in the presentation, there's two phases of Giostar. The part of Giostar that is focused on research, which is actually the core business of the company. And we have also the patient treating part of the company, which is the one that I work in Mexico. There's the clinics in India, China, and other places. But it's very important to differentiate stem cell therapy coming from Giostar than other companies or whatever's outside in the market, because stem cell therapy, it's not magic. And I think that also the way that some people try to simplify this situation, it makes people be more, they put a barrier in between them and stem cell therapy because of it. So I think something very important is to mention that Giostar Mexico, or Giostar itself as a company, what we do is that we personalize the treatment. That if you have seen, some of the questions have been very specific on, can stem cell therapy help me with this? And that's something that we get on a daily basis. And the question is, it may, but it depends on the specific case. So that's why we have a team of doctors, MDs, and scientists that needs to review every case. It's not a one-size-fits-all kind of situation. It's personalized medicine. It's a personalized treatment that needs to be reviewed in a case-by-case scenario. So I think that's very important. This is not magic. This is not something that we can assure everyone that it will help. But if you do have the interest on it, we're here to help. We'll review the case and we'll be very honest, as we do with many patients, that we honestly say that we can help, depending on the case.
Alejandro, I'm glad you said that. And I think that, Jana and I, being kind of, shall we say, pioneers in the, in the field of biooptimization and really looking at what people can do to optimize their health and wellness, we've had a lot of conversations about stem cells over, the last year. And I think the one thing that I keep coming back to is that there's a perception that stem cells are this silver bullet. Well, I'm going to go get, 40 million mesenchymal stem cells injected, and then I'm going to live to be 150. And I think that there are some people in the, dare I say, biohacking community who have perpetuated this myth that stem cells are this end-all be-all for optimal health, optimal wellness. And I think what we've discovered in all of this is just one element of a healthy lifestyle, right? I can't eat McDonald's French fries every meal, every day for 10 years and expect that one injection of stem cells is going to fix that. And to the extent that I think that a lot of people have come to this idea that there are quick fixes in health and wellness, that's just simply not the case. I can't live an unhealthy lifestyle and expect that a kale smoothie is going to fix all of that, nor can I expect that an injection of stem cells are going to do the same. So I've always cautioned people, or we've always cautioned people in this kind of biooptimization world, to recognize that if you don't optimize other areas of your life, diet, exercise, nutrition, supplementation, emotional, physical, mental, all of those things, the stem cells just aren't going to do anything. So, I think I really want to drive home that point as we've kind of worked together in this webinar to address the fact that, can stem cells be an alternative therapy for COVID-19? Absolutely. Can they be an essential part of healthy aging? Absolutely. But if you're not going to live a healthy lifestyle, if you smoke 2 packs of cigarettes a day, don't even bother getting on the plane and going to Mexico. It's just, small corrections equal big changes down the road. And then, once you lay that foundation of a healthy lifestyle, then stem cells can really jump in and bolster all of the work that you're doing.
That's exactly right.
Yeah,
sorry, Dr. Anand.
Yeah, so Orlando, you was telling something.
Yeah, I think that's actually when we met Evan and Jenna, when we met you there, and you visited our clinics in Cancun, and we talked about it. And I think that's why I think it's very important what we're doing, and I wanted to be a part of this webinar, and possible in the future to continue with this, because education is a key. We don't see this as a medication that we're gonna administer to the patient and that's it. We see this as a program. So our program in Mexico is quite complete. We talk about nutrition with our patients, supplementation, hyperbaric medicine. We kind of complement everything, because everything's important. As you mentioned, the lifestyle that our patients, some conditions are lifestyle driven. If you have a certain lifestyle, you're gonna get a problem. Diabetes type 2, very common situation. Obviously, there are people who have a tendency to it, but there is a lifestyle aspect. And if you don't make those changes, stem cell therapy is not gonna be the help. It's not gonna be this magic cure. So we try to be very responsible as a company. we understand, and I started the conversation talking about how complex but also controversial the topic is. Stem cell therapy is like that. I'm a patient myself. I was treated with stem cells a few years ago, and I know it works, but it's not magic. And we try and be very responsible as a company when we speak to our patients, when we speak to our possible patients, and we have a full team around it. I just want to take a moment to share some of the pictures of our clinics. I think just to show you, we are a clinic. That's our clinic in Cancun, in Playa del Carmen. Some of our facilities in Algodones as well. We have a full team of people working in customer service, nutrition, you name it, doctors, nurses. I also want to share invite you guys to go to our social media. I know that there's a lot of information out there. I invite you guys to go to our YouTube channel, Giostar Mexico. You'll find a lot of different testimonies of past patients. Wayne Hawkins, actually a former Oakland Raider, was treated in Algodones. We got a great testimony from him as well. That was part of a documentary that was filmed in Algodones. So we are a serious company. I think that's important. When you're talking about this kind of topics, you need to be able to discuss it with people who knows what they're doing and have the ethics to be upfront with our patients. And I think that moving forward, Evan and Jen, I think that your followers and people we invited to this webinar are the perfect candidates for stem cell therapy because of that interest in the lifestyle part of it.
You are right, Alejandro.
Okay, so I think that the time is gone. Jenna, Evan, do you have any other questions that you want to share with Dr. Anand?
I think we covered so much. I mean, I feel pretty,
Yeah.
I mean, all the information was amazing. I think it answered a lot of questions that I know our audience had. So thank you for taking the time to explain all that to them and to us as well. And yeah, very informative. So I think it was helpful.
And thank you very much, everybody. And if anybody has any specific question, they can always write to Giostar Mexico or directly on the Giostar, and we can divert their questions to a particular medical director. Because as I told, Giostar work in the combination of scientists and clinicians. And I learned this bench to bedside philosophy when I joined the University of California, San Diego Medical School, and the cancer center has the same philosophy. And that's from there I learned that how they do the research one side and how they try to translate that particular research in the clinic. So they have the research side, at the same building they have the bench to bed. So Giostar entire philosophy is the same way. So we collaborate, we try to understand, main focus how we may help people who are suffering with the devastating metabolic and degenerative diseases. And thank you again very much, Ivan, Anna, and Alejandro, your patience and explaining every single thing. And if anybody has any question, please feel free to write to Giostar Mexico or Giostar directly, Ivan and Anna also. They may connect us. So thank you again, everybody. And please help people whatever way you can help for the people who are suffering with the COVID.
Thank you so much for joining us, and we'll continue to post some content and educate your audience. Evan and Jenna, thank you for the opportunity.
Absolutely.
Thank you guys, really
so much.
appreciate it.
Thank you.
Thanks.
Yeah.